Hello, and welcome to Check Up with Bluegrass, the official podcast of Bluegrass Community Hospital, where we take you behind the scenes of the care, people, and programs that make a difference right here in Woodford County. My name is Cliff Wilson, and I'm currently the interim CEO at Bluegrass Community Hospital and the market president for LifePoint Central Kentucky, and I'm honored to be on this month's episode as the host. As you may know, May is Mental Health Month, and we are taking this opportunity to talk about something especially close to our hearts, and that is mental health in older adults. As we age, we face new challenges, loss of independence, chronic illness, grief, or isolation. While these issues may be common, they're not often talked about enough, and they can take a serious toll on a person's emotional and physical well-being. That's why today, I'm joined by two incredible guests from our Senior Life Solutions program. Kelly Holland, Program Director, and Jerry Riley, Licensed Clinical Social Worker. They're here to share how this program is helping seniors in our community not just cope, but truly thrive with the right support. Let's dive into this important conversation. Kelly, we're going to start with you.
Great.
Can you start by giving us an overview of what Senior Life Solutions is and how it works?
Sure, Cliff, and thank you for having us. We're really excited to be here. Senior Life Solutions is an outpatient program here at Bluegrass Community Hospital that serves the older adult population, typically age 65 and older, who may be suffering from depression, anxiety, or other psychological symptoms typically associated with the aging process. Now, the program is very straightforward. You get a referral. I usually do the comprehensive confidential assessment of the patient.
Right.
After meeting with our medical director, if they meet the criteria for admission, they're admitted to our group therapy program. They attend in the beginning therapy 3 days a week, 3 groups a day. And then they start to meet their goals and titrate down. As they get better, they come less often. So they come 2 days a week, 1 day a week. As part of our therapy, they will also receive individual therapy with our therapist, Jerry. And depending on their individual needs, they either come twice a month at minimum up to 4 times a month. They also receive medication management and medication education. And another great component of our program is our aftercare planning. Mm-hmm. And after graduation from the program, we don't just say goodbye. They maintain a part of the Senior Life Solutions family into the future as long as they need us.
That's awesome. Thank you for that. And what types of patients or concerns is the program really designed to address?
Well, I mentioned that the people who come in are typically depressed, anxious, have some type of psychological symptom going on. So what that might look like in the community is someone who has experienced a recent loss. Maybe their spouse or a child has passed away. They may have lost their home and had to move into a downsized apartment or an assisted living facility. They may be suffering from a chronic or a new health condition that has limited their mobility. Maybe they can't drive any longer and they're isolating more at home. Other things that you might see in the type of person that would be referred to the program are those actual physical symptoms that come along with depression and anxiety that we might be writing off to just aging process.
Yeah.
Maybe they've got stomach discomfort, diarrhea, constipation. They've lost energy, they're sleeping more or sleeping less. Maybe their appetite has changed. These are all things that, if you notice going on, are reasons to reach out to us.
That's great information. So why is it so important that we have a mental health program that is specifically tailored for an older adult?
Well, we all go through changes in our lives, but as older adults, there's a lot of things that happen due to the aging process. A lot of grief and loss, loss of independence. You maybe don't have that sense of purpose you once had when you had a career or you were raising a family.
Good point.
So this is a group designed for the people that are experiencing those later in life challenges. And having this group dedicated just to them, they get to talk about their own issues and support one another during the group process.
Very good. So somebody listening to this, or someone's family member, may want to know a little bit more about what does a typical day look like for someone that is enrolled in our Senior Life Solution program.
Well, they start the day around 9:45 in the morning. They come in and they meet with me first because in addition to being the program director, I am the program nurse. So I'm going to do a little physical assessment every time they come in. We're going to get a weekly weight and monitor to make sure that their appetite is stabilizing and that they're not having any weight change related to medication. I'm going to get a full set of vital signs and ask them about their medication compliance, sleep, how their mood is, and I'm going to reach back out to their primary care provider with any physical concerns that I notice, especially blood pressure, which is really great for this population because maybe they only see their primary care provider twice a year. Maybe they they can get a better management of their blood pressure with these frequent letters if they need it to their doctor. After they're finished with me, Jerry tends to start group at 10 a.m. There's going to be 3 group sessions with a break in between each session. And during that last group session, they're going to get to eat lunch together while they have that group. One day a week, they're going to have a 4th group session, which is a nursing group that either myself or the office patient coordinator, Brianna, will facilitate. And it can be on just a variety of topics. And they really tend to enjoy that group because it's a little more laid back and fun. But that's what a typical day looks like.
Thank you for that overview. And it's great. It talks about the mental health component, but there's also a clinical side of it with the vitals, and we're really looking after the patient's overall well-being, it sounds like.
Absolutely. And there is such a correlation between the mental health and the physical health, especially as we're older and we have more comorbidities.
That's great. So Kelly, what would you say, or how do you engage patients who may be hesitant or unsure about participating in a mental health service program?
Well, the first thing you want to do is establish rapport and build trust. There's a lot of stigma around mental illness, especially in the older population. So we want to make sure that we're focusing on their health and that this is part of their health.
Right.
And we want to make sure they understand that this program is completely confidential, that there is an element of trust among the group members, that they will not leave the group and discuss anything that they see or hear while they're at the program.
Okay.
And that tends to ease their concerns a little bit. And we just normalize being a part of this program. Jerry is an excellent facilitator, and it feels more like a conversation than it feels like group therapy. So
very good. So what role does family or a caregiver play in terms of the overall success of the program?
Well, family support can be very pivotal in their success, but our patients have to consent to their involvement. And if they do consent...
That's a good point.
Yeah. The family notices symptoms that maybe the patient hasn't noticed, and they can make the referral, they can comment on the improvements, and just help them to accept that this is a normal part of getting better by participating in the program. They can help them with achieving their goals. Sometimes Jerry includes the family in the goals that we set for the patients, and if they need it, we do offer family therapy as well.
Very good. So, Kelly, how do you measure success? What kinds of outcomes are you seeing from patients that complete the program?
Yeah, I've in my past careers have been a performance improvement person, so we have some actual statistical data to support that this program works. We do monthly assessments, some generalized questionnaires that we ask our patients. We do it at admission, monthly, and at discharge. And overall, the patients who graduate from Senior Life Solutions across the country have a 90% improvement in their symptoms. We see a reduction in depression, a reduction in anxiety, as well as other psychological symptoms that may be related to trauma. Mm-hmm. So the patients do get better coming to group.
Very good. So lastly, what can community members do if they think a loved one may be a benefit from this program?
Well, they can call me. They can call the program at 859-879-2459. They can also go to the Bluegrass Community Hospital website. There is a link for Senior Life Solutions on there. Anyone can make a referral, from primary care providers, patients, family, clergy. The person themselves can refer. And just reach out to us for that confidential assessment that they'll receive.
Very good. Thank you so much.
You're very welcome. Thanks, Cliff.
You're welcome. All right. So now we're going to talk with Jerry Riley, licensed clinical social worker. We're super proud to have her as part of our team. Jerry, you ready?
Yes, ready.
All
Thanks,
right.
Cliff, for having us.
It's good to be with you today. As a therapist, what are some of the most common emotional challenges that you see as a clinician in that senior population?
Sure. So Kelly talked a bit already about some of the physical symptoms and other ways that depression and anxiety may manifest. And sometimes when we're experiencing these symptoms, it may not feel so clinical or clearly defined, right? You might have someone that doesn't even have insight or awareness to depression. Maybe they felt this way for a long time, or they think that it is a normal part of aging. And so some of the common emotional challenges I see is group members will come in and feel a bit stuck in life, maybe hopeless or helpless. Okay. And maybe that's due to navigating through age-related transitions. Maybe it is learning to live life in a different pace with new physical limitations. We definitely have seen group members come through that have been isolated, maybe even more than they really recognized. Yeah. And, you get into a group setting and you build rapport and these friendships with peers. And then you start to say, I don't think I even knew how depressed I was. I don't know I didn't realize how lonely I was feeling. Grief, we have group members come that have lost a loved one, and learning to live life alongside that grief, right? And they'll say, I've heard that time heals, but what can we do, every day to live more comfortably with that grief? And so those are some of the common emotional challenges.
So let's unpack that a little bit more. How does the therapy through Senior Life Solutions help someone regain that confidence and the emotional resilience?
Sure. So what are we getting from therapy, right? Yeah. What are the things that we are doing that make life look differently because of therapy? I'll start with just normalizing the experience of depression and anxiety, not in any way to dismiss it, but really to say you're not alone in this, and the group dynamic offers that. We work on learning and developing coping skills, more than learning and developing how to truly implement them. How do I utilize this in daily life? A lot of our group members will come and there are things in their life that unfortunately are not going to change. Yeah. Maybe there is a loss of a loved one. Maybe there is a diagnosis or physical limitation that's not going to go away. Maybe there's financial strain, right? Some of these external factors are set, but is there a way that we can think about these things differently? Is there behaviors or actions we could take to ultimately allow us to feel better in the life we have? And so that is a big component of regaining confidence. Mm-hmm. Just gaining new perspective. You do that through, as a therapist, I'll offer that, but gaining perspective from your peers. Learning new thinking patterns, recognizing maybe some distortions in thought. And then lastly, I'll just speak on, you get to identify some of your strengths. We're all very resilient and equipped people. Right. And unfortunately, our brain has a negative bias. And so we like to gloss over the good things about ourselves, right? They become to feel ordinary. And in group, those strengths are truly mirrored back to you. We're going to celebrate these micro wins. And with every micro win and small accomplishment, that confidence is going to grow and that resilience is going to, you're going to feel empowered.
Great examples. Thank you. So, in the spirit of that, are there any particular breakthroughs or patient stories that have really stuck with you in your work?
Sure. All of our program, all of our patients that have come through the program, their treatment is very individualized. You know, everybody comes with symptoms that present a bit differently. Everyone's success looks differently. Everyone's discharge looks differently. But one thing that really stands out to me before I jump into specifics is it is always really inspiring to see someone as an older adult in that stage of life willing and eager to do self-work, learn new things to feel better. I mean, that's truly incredible. We had a group member that presented with just basically inactivity, right? The depression had gotten to a point where when she admitted saying, you know, it took all I had to get out of bed in the morning. You know, that was exhausting.
Right.
And then through the program, seeing gradual growth and gradual accomplishments to cut to her discharge where she is finding a recipe for a cake she wants to bake and bakes it and shares it with her family, and then comes back to group and shares with the patients. And so from going from I can't get out of bed in the morning to I'm hosting a holiday dinner, that's quite a transformation.
Yeah, very transformative.
Yeah.
So I think human nature in general is probably a little more resistance to group therapy. So tell us, how does participating in group therapy benefit older adults compared to a one-on-one session that might initially be perceived as more comfortable or willing to do?
Sure. Great question. Our program is a combination of both. I do meet with our group members individually, but the emphasis and bulk of the program is group therapy. And, as a therapist, I offer compassion, empathetic, I'm listening. And that is great and beneficial, absolutely. But imagine doing that alongside 6, 7, 8 other people who are also offering those things. And more so, they're relatable. They're living in this stage of life as well. They're experiencing similar things. I think that to be truly heard and seen by your peers can maybe make some of these obstacles and transitions that feel very isolating feel more real. Like, I'm not the only one going through this. That validation is empowering. And so the group dynamic really offers a type of understanding that me as a therapist strives to offer, but again, there's an age disparity between me and our group members, and their commonality in that is just cohesive. Also, I think that it offers a layer of accountability in a really encouraging way, in a way of I'm gonna go to group and check in with my peers, and they're gonna say, hey, did you do that thing that you said you wanted to do?
That mutual accountability.
Yes. And, the group members really talk about that being a really encouraging part of the program. They'll come in and say, I couldn't wait to share this.
That's great.
So the group dynamic is what allows those.
Very good. So, Jerry, what would you say to a senior or their family member who may be feeling uncertain or perhaps even embarrassed about seeking help?
I would first say, I get that. It's understandable. Anything to do with our health or wellness, you can feel a bit uncertain about. In speaking to feeling a level of embarrassment, we know that there is a stigma with mental health, but we also know that addressing your mental health is just as important as your physical health and overall wellness and fulfillment in life. And so I would encourage someone that may feel like they are not tapping into life or leaning into experiences as much as they want or as well as they once did before, to take a chance and reach out for support, because help is out there. But I would just start with normalizing that it's okay to feel those things. I think that we've come a long way in mental health, but I also think that embarrassment could stem from feelings that these symptoms that come from depression or anxiety are almost like personal flaws or weaknesses, and really chipping away at that false narrative to offer a little bit more comfortability.
Very good. So I'm sure some of our listeners want to know, like any program that we might participate in, how do you help patients maintain their progress once they complete the program?
Yes.
So after they're done, how does that work?
Great question. Discharge planning, I'll say discharge planning is the first part of this. We start planning for discharge on day of admission because it's inevitable. It's where we're headed. And if we can plan and have a really strong discharge plan in place, we can discharge confidently. We can discharge and say, hey, we've got the supports to maintain this growth and improvement that I've worked on. Discharge looks differently for everyone. Kelly mentioned a little about titration. So you may join the group coming in at 3 days a week, and as you improve, you drop to 2, and then you drop to 1. The hope is as you titrate down, you're adding things in your daily life that are going to offer that same sense of social connection, activity level, and that may look like attending a local senior center, getting involved in a church, volunteer work. But we hope that your discharge plan, you don't discharge, you don't graduate and say, what next? You know what's next, and you're already doing it.
That's a good point. We start at day 1.
Yeah.
I like that. So, Jerry, lastly, why is it so important to talk about mental health during Mental Health Month, but also year-round?
Yeah, absolutely. It's important because there is a stigma, and there is a layer of embarrassment potentially with seeking help for these types of things. I think that the more we talk about things that feel uncomfortable, they do become more comfortable. We normalize it, and we just really want people to understand that, or people to know that there are programs and support out there, and that yeah.
And if I can just jump in for just a second, I want our seniors in the community to realize that it isn't normal. They don't have to feel bad. A lot of people think I hit 65, I'm supposed to be tired, I'm supposed to be grumpy and sad, and I'm supposed to stay at home all day. And they don't have to. And
That's
this
a good point,
program
Kelly. Yeah.
helps get them back out. And that's really, why we want to talk about this all year long. So they know that they can still have purpose and happiness into the ends of their days.
Absolutely. Wow. Well, thank you again, Kelly Holland and Jerry Riley, for sharing not just their experience and expertise, but also their hearts with us today. The work that you are doing through Senior Life Solutions is truly life-changing, and for many in our community, life-saving. At Bluegrass Community Hospital, we believe mental health is health, and we are proud to offer programs that bring care, connection, and hope to our senior population. If you or someone you love could benefit from Senior Life Solutions, we encourage you to reach out. You can learn more by visiting bluegrasscommunityhospital.com or by calling the hospital directly. And to all of our listeners, thank you for joining us. Please be sure to follow Check Up with Bluegrass and stay tuned for more conversations that highlight the people and programs that are making a difference right here in Woodford County. Take care, and until next time, stay healthy and stay connected.